Hi, I'm Greg Feld, Director of Public Health in Sheffield. This is the COVID situation report as of the 22nd of November. Rates first, epidemiology. Flat overall. Last week rates were falling. Rates continued to fall over the course of the week, but flattened towards the end of the week. And as I've said before, I think we'll see an oscillating pattern over a period from a very high baseline. I shall come back onto that in a moment. All up, rates continue to fall in the over 60s. That's the group arguably I'm most worried about because it's the group most likely to be made severely ill. That is the impact of boosters. The booster program has accelerated massively over the last couple of weeks, and that is having an impact. There's no two ways about that, and that's having an impact. Slight rise in the age-specific rate for under 16s, and kind of a bit up and down for the adults in the middle. Don't know how that will play out over the rest of the autumn and then into winter. I suspect it's unlikely that rates will go down massively any time, but they might just stay around the rates that they are. That is hugely problematic for the NHS and social care. Again, I shall come back onto that. We have seen that on a number of occasions that the epidemic can flip really quickly. We've seen that on a number of occasions over the course of the whole pandemic. Impossible to say whether that will happen, but I would encourage you all to look at what's happening in, say, Austria and the Netherlands, where the case rates have gone up a great deal very quickly, and their governments have imposed lockdowns. It's impossible to say whether or not that will happen, and anyone that tries to predict that is on a fool's errand, but it could. So what you see in terms of what's going on in the NHS and social care system in the media is true, very, very true. It's very much happening in Sheffield. It's very much happening in every town in the city. The NHS and social care system is under extreme pressure. That's not looking like it's going to recede anytime in the near future. That puts the onus upon us to do all we can to ease pressure on the NHS and social care system, because we want it to be there to provide for us in our moment of need, as should that come. So all we can do to ease pressure, it will help that situation. As I say, predicting how this plays out over the autumn and then into winter is almost impossible. Worth me saying that somewhere in the order of 85% of those who are in intensive care with COVID, and there are people in intensive care with COVID, and there are sadly still people dying with COVID, about 85% of those in intensive care with COVID are not vaccinated. The vaccination is doing the thing it said it was. I hear a lot from people, there's still many people who haven't yet had dose 1 and 2. Oh, I missed my chance, it's too late. It's never too late. There is always a needle or a vaccine that is ready for you should you choose to come forward. And I'd encourage you all to come forward if you haven't yet had doses 1 and 2. And obviously we are getting into boosters in a very, very heavy way at the moment. So we know what we need to do to reduce the risk of further upward inflation in the COVID rates and the harm that may come from that. And it's worth watching very carefully what happens in some parts of Europe, and the Prime Minister hasn't ruled out lockdown in this country yet. That may or may not come. So we know what we need to do. Get vaccinated. If you have symptoms, stay at home. Wear a face covering in enclosed public spaces. Open the windows, get some fresh air in, and wash your hands frequently. All of those things have collectively made a difference and will continue to do so. So I encourage you all to do that. So on vaccination specifically, from today, people aged 40 to 49 can book a COVID booster jab. The extra dose can be given 6 months after the second jab. You can get a booster if you are 40 years or over. If you're 16 or over with a health condition that puts you at high risk from COVID, and simply that's if you're eligible for a flu jab most years, then you're in that group. If you're a frontline health or social care worker, or if you're an adult living with someone who is immune suppressed. All of those are people that should be getting boosters, and many of you are, and thank you for that, because that has made a massive difference. The speed of acceleration of the booster program over the last couple of weeks has really been remarkable. You can pre-book your booster. I encourage you to do so. It's really easy, but you can book in on the national booking system, and it's really easy to find on a number of internet search engines. 16 to 17-year-olds should also be able to book their second vaccination on the national booking service from today. Can also do walk-ins 12 weeks after your first vaccination are also available, and there are lots of places within Sheffield where you can do that. For 12 to 15s, there'll be additional support for 12 to 15 vaccinations in the coming weeks, and we'll update social media on that, so please look out there for more information. And lastly, on pregnancy, very specifically, the figures on this are quite stark. Worryingly, the figures are showing that of the 1,700 or so pregnant women in England that were admitted to hospital with COVID between 1st of Feb and the end of September, 98%, almost all, weren't vaccinated. And same stat, so more than 98% of those admitted to intensive care were also unvaccinated. All of the medical evidence, all of the medical opinion is absolutely clear that the benefits of vaccination far, by many orders of magnitude, outweigh any risks in every area. It's never too late to be vaccinated. Don't feel like you've missed the opportunity. You haven't. There is a vaccine waiting for you, ready for when you book. So book now, or visit one of the walk-in clinics across the city today, because it's one of the areas where the benefit is overwhelming.